Just talk us through what we've heard and where it goes.
Well, Emily, this potentially has huge ramifications. You mentioned the US Trade Representative Catherine Tai just there, and just listen to her language. She's saying, look, we strongly believe in intellectual property protection. That's protecting the rights, the brains and the money of the companies that have developed these vaccines. Completely understand that. But then she went on to say the extraordinary circumstances of the Covid-19 pandemic require extraordinary measures. Now, there's been a huge debate about getting the World Trade Organization to waive what are called the trade-related aspects of intellectual property rights. That's known as TRIPS. The advocates for that say, look at Brazil and India. Look at the developing world. 1.1 billion COVID vaccines administered so far across the world, only 18 million in Africa. On the other side, you've got countries like the UK and the EU, supported by the pharmaceutical companies, raising concerns, saying, well, maybe you could hand over novel technology to China and to Russia. On their side, they have Bill Gates, the great philanthropist. He said, look, this idea is not going to speed up the distribution of vaccines. His idea is that financial donations are the best way of going about this. Now, Newsnight has done a lot on this. Last week, we had Mary Robinson, the former President of Ireland, saying that this waiver is necessary. She's the head of the Elders, that's the former world leaders. And Joe Biden, he is facing an awful lot of pressure on his left in the Democratic Party, very keen on this. But of course, the World Trade Organization tends to work on consensus, and there isn't a consensus on this over there.
That's going to be tricky, isn't it? Nick, thanks very much indeed. Well, in a moment, we'll be hearing from Richard Talbot from the Association of the British Pharmaceutical Industry. But first to David Miliband, Chief Executive Officer of the International Rescue Committee, now resident in New York. David Miliband, do you think this is the game changer that it sounds, or is it just a sort of a nice gesture towards it?
I think that it's part of the puzzle for getting out of the current COVID crisis. I'm sitting on the independent panel on pandemic preparedness and response, which is reporting next week. And it's clear that there are three major aspects of this that need to be addressed with incredible urgency. First of all, the redistribution of the vaccines from the rich world to the poorer parts of the world. Estimates of 2 billion excess orders in richer parts of the world. So there's a redistribution part of this. Secondly, once the vaccines get to the poorer parts of the world, they need to be distributed effectively. We can't have them sitting in storehouses, the sort of places that the International Rescue Committee works. Cold chains are an enormous challenge, so you need to get the distribution right. And then thirdly, there's production. And this is where the vaccine move that the Biden administration have taken is so significant, because production needs to be significantly ramped up. And I think it's very significant that the Biden administration should have followed their words about war footing on the domestic front, the need to tackle COVID on the domestic front with a huge effort. They're now matching that globally because they recognise that business as usual will not make the world safe.
I mean, I guess the UK government could argue that actually they'd already given the world AstraZeneca, that it was already done at cost price and that there was no money, real money, being made from this. And so it doesn't have to follow suit in the same way that the US has done. Does that work as an argument?
Well, I think it could say that, but it would be unwise for a couple of reasons. First of all, the UK does have a good record of donating to COVAX. That's welcome. But it's obviously battling the reputational and substantive damage of the aid cuts that are being announced and that are doing a lot of harm to Britain's reputation as a serious global player. Now, with the Biden administration having thrown its weight behind this temporary waiver, which needs to be negotiated through the World Trade Organization, I think it's very important both to get the work done, but also in the British national interest to be part of the solution to this. I'd be saying, if I was in government, look, there are details that need to be worked on, but rather than standing outside the room and saying, no, 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 we should be inside the room making sure this is done in an effective way. Because the history of health efforts in this area, for example, if you look at some of the medicines where there have been some similar waivers in respect of HIV, I understand it, obviously not a vaccine case, but a medicine case, it's worked well. And we've managed to make that those waivers part of the ramping up of production, which is so important alongside the redistribution and the effective distribution in poorer countries that's so important.
Isn't it interesting, though, to hear Bill Gates, really at the forefront of global vaccination, be so anti this as a solution? He says financial donation is by far the best way, not this.
Well, it's both and, not either or. I think Bill Gates I saw certainly one of the interviews he did about this, and he said, don't present this as a panacea. And he's absolutely right. That's why I'm emphasizing the urgent need to get on with the redistribution of the 2 billion excess doses, to make sure that once these vaccines do reach the poorer countries, we've got effective distribution systems so that the whole of those countries is covered. And I don't think this is a matter of making the best the enemy of the good. It's a matter of recognizing that we are in the middle of the most unbelievable global crisis. We've been landed here after a series of reports over the last 20 years have warned of the dangers of a pandemic, and there was no political leadership. Now is the time for political leadership, and that's what I think President Biden is determined to offer. And I think it's incumbent on the British government to join him rather than standing on the side.
Let's pick up with Dr. Richard Torbett, who represents British Pharmaceutical Industries. And we did, I should say, ask the government to come onto the show. They couldn't be with us. But Dr. Torbett, when you hear the excitement there is about this, not as a panacea, but as one part of the solution, do you embrace it?
What I completely embrace is the desperate need to ramp up manufacturing as quickly as possible and to do everything that we possibly can to find the right solutions to get these vaccines to everyone in the world that needs them. I actually agree with much of what I've just heard from David Miliband. I think now is the time for really strong political leadership. I was very, very pleased to see the G7 communique today that was made it really clear from the G7 governments about the financial commitment to COVAX as a multilateral mechanism for dealing with vaccines access. This is incredibly important, and we want to be very, very much part of this solution. But honestly, we're genuinely worried about this IP issue.
Because?
We're worried about it for a couple of reasons. Firstly, I think it's important to note that we've gone from 0 vaccines to, in 2021, if all goes well with all the regulatory approvals, we'll have over 10 billion doses already. So actually, we are producing at a massive, massive scale right now. And the companies have done that because they are voluntarily seeking agreements with manufacturers around the world that are credible and that have the skills, that have the equipment, that have the knowledge to be able to do the technology transfer to produce safe and effective medicines. Now, our worry is that if you waive IP, you could find yourself in a situation, we could find ourselves in a situation where scarce supplies that are desperately needed to keep that manufacturing going could end up in companies that might not know what they're doing. And that will be really damaging for confidence.
Let me just go back to David Miliband on that one, that you relinquish quality control, in essence.
Well, I think the key is that you don't. And that's why President Biden is proposing detailed negotiations and regulation to ensure that the dangers that the doctor suggests do not come about. I think that's very important, that we're round the table making sure that the details are properly worked out. And it's worth remembering that there has been significant R&D privately funded, but it was underwritten by government commitments, notably actually by the Trump administration, surprisingly to many people, that guaranteed and support so that the private sector manufactured at risk. In other words, they started manufacturing these vaccines before they knew whether they would work, so that when they were given regulatory approval, they were able to be rolled out quickly. And so this has been a public-private partnership all the way through. The voluntary licensing that the doctor refers to is very important. So are the issues of technology transfer. But this isn't going to be the last dangerous pandemic we face. We need to forestall the next one. And so the arguments here about how we get on to the right kind of war footing for a global challenge of this kind are going to be important, not just for this crisis, but going forward.
Richard Torbett, there is a danger, I guess, that the pharmaceutical industry looks like it's protecting its own here, that some of the companies have seen their shares fall on this news, and it looks as if they're putting up the citadel on the very idea.
Yeah, of course that's how it will look to many people. And all I can say to you is that this is really not about the money. Although, of course, I think the point about planning for future pandemics is a material issue here, because, of course, we need these companies to keep investing and keep preparing themselves for the tomorrow, keep adapting to new variants of the current virus and planning for the next ones. But I'm completely realistic about the pharmaceutical industry's role in this debate. It's critically important that all of the companies are responsible, are going the extra mile. The companies need to provide leadership just as the politicians do.
Okay.
And I think, look, we want to keep talking. There is no doubt that the industry will keep talking to the Biden administration about this and what checks and balances can be put in place to manage the risk.
All right.
It is a genuine risk that there'll be consequences for this. But it's a complicated problem, and the solutions will also be complicated and not simple.
We're out of time, but thank you both very much indeed. Thanks for joining us this evening.